Good morning, it's Sandy here with the Minto-Mapleton Family Health Team, and I'm one of the kinesiologists here. And I'm going to take you through session one of the GLAD knee and hip osteoarthritis education session. Welcome. So first we want to acknowledge the founders of this great initiative from Denmark and the GLAD Denmark team and the GLAD International Network. So GLAD is run as a not-for-profit initiative, and it's now an international community and receives supports from all around the world, with all countries helping each other. GLAD stands for Good Life with Osteoarthritis from Denmark. It includes the researchers, certified clinicians such as myself, and all of you are part of it. And we are doing this to ensure that all around the world, everyone is going to have received guideline recommended care for their arthritis in clinical practice. What does it include? Well, we are offering 2 education sessions with our program and then 12 supervised exercise sessions over the course of 6 or 7 weeks in our Palmerston site. And that is the smallest dose. So we hope that you will continue your dose of this exercise on your own thereafter. The objective for patient education is to give you a better understanding of the disease, risk factors, symptoms, treatment options, including potential benefits and harms, and what you can do to manage your symptoms. The factors that contribute to the pain and challenges that people face due to their arthritis are more complicated than you might think. They may include physical, mental, and lifestyle factors, and we want you to understand as much as possible about all of these things to help you improve your condition. Research shows that knowledge about osteoarthritis can have a positive impact on your pain and quality of life. There are many tools or strategies on how best to deal with arthritis. Research shows that the best first-line treatment available for mild, moderate, and severe difficulties due to arthritis is exercise, patient education, and when needed, weight management. This program will provide you with advice and tips that can be applied to the types of exercise and physical activities that you decide to continue with once you have completed the 12 neuromuscular exercise classes targeted to your arthritic joint. In this session, we're going to cover what arthritis is, especially osteoarthritis, the risk factors and diagnosis, and then an overview of the treatment plan. What is osteoarthritis? So osteoarthritis will affect your whole joint, and it's influenced by many factors. Osteoarthritis can affect any joint in the body where cartilage covers the ends of bones. Think of cartilage like a protective sheath over the bone's ends at your joints to allow them to more easily move over top of each other. Joints that are most frequently affected with osteoarthritis include your hands and fingers, the knee, and the hip joint. It is a lifelong disease, and it affects not only the whole joint itself, but also things like the articular cartilage, the joint capsule, ligaments, muscles, and any underlying bone. Osteoarthritis isn't just affecting older people, but it also affects younger people's quality of life because many younger people will experience pain when they do sport activities or any physical activity. And if that's the case, they should maybe think about doing some exercise to support their joints. When we think about imaging, x-rays and scans, for example, they're frequently overemphasized because of the poor link between symptoms and findings on them. And so we will talk a little bit more about this a little bit later and how helpful or when they are helpful. In the past, it was thought that osteoarthritis was as a result of wear and tear, that your joint was actually worn out. And it used to be known as the wear and tear disease. But this language has led many people to believe that they cannot or actually should not be physically active when they have osteoarthritis. And this is not correct. And in fact, many studies have shown the opposite, that actually your cartilage needs moderate load through physical activity and things like walking, for example, to actually nourish it and keep it healthy. We also know that many things can influence your pain. as well as structures in your hip and knee. Things like stress, thoughts, and your beliefs can also influence how much pain you feel. In addition, osteoarthritis is caused by several risk factors, and not only because of overload during things like work or sport. For all of these reasons, osteoarthritis is a more appropriate term for the disease. Osteoarthritis is a very common disease and is actually the most common lifelong disease in people over the age of 65, and thus more common than high blood pressure and diabetes. A lifelong disease means that once you have developed osteoarthritis, you will have the disease for life. The symptoms may, however, vary and they actually can be improved with treatments such as exercise. The prevalence or number of people with osteoarthritis increase sharply with increasing age. 30% of all people aged 45 or more report knee or hip pain. Age alone does not cause osteoarthritis. So, for example, not all older adults get osteoarthritis, and some people are younger when their symptoms start. People with previous knee injuries from sports usually have 4 to 6 times higher risk of developing osteoarthritis in that particular joint as they get older. For about half of these people, the osteoarthritic changes of the bone and cartilage are established about 10 to 15 years after the injury. The joint is the connection between two bones. Without joints, we cannot move around. The ends of bones are covered with articular cartilage, which forms sliding surfaces. The surface of the cartilage is white, hard, and smooth to minimize any friction during movement. For the cartilage to get the adequate nutrition, it needs that dynamic load. Dynamic load is the repetitive cycle of load, unload, load, unload, such as in walking. The articular capsule around the joint produces the synovial fluid, which helps the joint get a nutrient supply. The way cartilage works may be compared to a sponge. When the joint is loaded, fluid is pressed out from the cartilage tissue. When the pressure eases and the joint is unloaded, the fluid is sucked back into the cartilage. And around the inside of the joint are ligaments that help to mechanically stabilize your joint. The muscles help to both stabilize and move your joint. The stronger the muscles are, the better they stabilize the joint, and it is easier for it to move around. Strong muscles will also absorb shock and distribute load more easily for the joint. The knee joint has two menisci. They're on the outside and inside of the knee joint. So a lateral and a medial meniscus. They are two C-shaped pieces of tough, rubbery cartilage that act like shock absorbers between the shin bone and the thigh bone. The meniscus has one main task to help distribute the body weight over the joint surfaces when walking and running, and help stabilize the knee joint together with the ligaments. If the menisci are missing, perhaps because of surgery, the joint surfaces are exposed to increased stress, and osteoarthritis likely will develop faster. The hip joint has a labrum, which is a piece of cartilage that runs around the rim of the socket to provide a suction seal and increase the stability of the joint by increasing the contact surface. Absorbing shock and distributing pressure during hip motion is its main task. Much like the meniscus of the knee, the hip labrum may become torn or even detached from that articular acetabular surface. As you know, osteoarthritis affects the whole joint and not only the articular cartilage. Symptoms can be present without visible changes in the joint, and in general, there is that poor link between structural findings in the joint and your symptoms. Many other factors have an impact on symptoms, which we will discuss next session. The cartilage may change Or cartilage loss may be seen on imaging, but not necessarily. Sometimes osteophytes and subchondral bone changes are also visible on an image as well. Swollen and inflamed articular capsule is quite normal. Baker cysts are often found in the back of the knee, or muscles, tendons, and ligaments can often be painful. The pain associated with osteoarthritis does not come from the articular cartilage, as the cartilage has no nerves. Instead, it is the surrounding structures such as bones, ligaments, which are the connection bone to bone, and the joint capsule or the tendons, which connects muscles to bone, that actually hurts. Meniscal and labral tears are part of osteoarthritis. If you're middle-aged or older and your pain isn't caused from a severe joint trauma, such as a fall or maybe a sports injury, your pain is most likely related to your osteoarthritis. Very often, a meniscal or a labral tear is an early sign of osteoarthritis. Structures around the joints will begin to get older as you become a little older as well. The tissue is less durable. The tears may develop from insignificant trauma or without any trauma at all. The good news, however, is that exercise therapy works well with people with a meniscal or labral tear, as well as with or without any other signs of osteoarthritis. For many years, arthroscopy, also known as keyhole surgery or scopes, were considered necessary to treat your meniscal tears in the knee. However, international guidelines recommend against scopes for people middle-aged or older with a meniscal tear, with or without imaging evidence of osteoarthritis, mechanical symptoms, and regardless of whether the symptoms came on suddenly or slow. This shift has happened because many studies from all over the world are showing that scopes has no better effect when compared to fake surgery or just to treatments such as exercise alone. Since there is no strong evidence to support scopes for labral tears either, surgery should only be approached with caution, and today the same treatment is recommended for a meniscal tear as for arthritis. That treatment is exercise therapy. Do you recognize the classical symptoms of osteoarthritis? Classic development of symptoms happens slowly and over years, but for some, symptoms can develop faster. Symptoms even fluctuate. Periods of more intense symptoms can be followed by periods of reduced or no symptoms at all. The length of these differing periods varies. Many find no or poor links between activity they do and the symptoms they experience, and is therefore difficult to predict periods of more intense symptoms. Pain on weight bearing and joint noises. They're the first noticeable sign of osteoarthritis. And usually it's things like walking or running that causes clicking and or grinding noises that can often be heard or felt from the joint. Sounds from the joint itself are not considered harmful. Stiffness and reduced range of motion is another symptom. It's common, and especially when it comes from straightening or bending the joint fully. For example, if you squat down. Most often, the feeling is short-lived and goes away when you get up or start moving again. If you are not able to straighten your leg fully, this will affect the way you walk and how you bear weight on the joint surfaces. Feeling of instability. So often instability or uncertainty when loading that feels like the knee might or hip might give away. It's a feeling of not being able to trust the joint. A feeling of instability is very, very common. Good news is that exercises to build your muscles will help decrease this feeling and help you to regain your confidence. Another common symptom is pain at rest. So in the beginning, pain often occurs during weight bearing, for example, when you walk or climb stairs. And later in the process, the pain may also occur at rest. or after a long night's sleep, you get up in the morning and you notice it. So interesting enough is that even night pain can disappear when you start to exercise. Data from the GLAD participants show that around 45% suffer from night pain when starting GLAD, and that night pain was reduced or even disappeared completely for some participants during the training period. Another common symptom is knee joint swelling. When you have knee osteoarthritis, the joint can be swollen, and it's usually a sign of inflammation. It is important to emphasize that this is not a sign of infection. Infection would be a very hot and stiff joint accompanied with chills, fever, or nausea that can sometimes occur after surgery. Normally, inflammation is a useful body reaction. It helps to fight infection and repairs injury, but when you have developed osteoarthritis, it is not a beneficial reaction. Exercising can help to reduce inflammation and your symptoms if it is adjusted to your needs and symptoms. Pain location can vary for your knee osteoarthritis. It can be located above the knee, at the inside of the knee, the outside, behind the kneecap, or even down your lower leg. Basically, all around the knee joint. Whereas hip arthritis, osteoarthritis, you might feel the pain in many places. So either along the outside of the hip, maybe into the groin where the hip joint is actually located, perhaps the inner or outer side of your thigh, deep into your buttocks, or down along your thigh. Sometimes pain from hip osteoarthritis is located more down toward your knee. This is because the nerves that supply the hip joint also supply the skin above the knee. People with osteoarthritis of the hips and knees often report having difficulties with some of the following activities. Your leisure activities or any sports you might play. If you have a physically demanding job, it might make it a little bit more difficult. Playing with your children or grandchildren or being able to get down onto the floor with them. Changing directions or turning with your body. Putting on your socks and shoes might be a little bit more difficult because of your arthritis. Standing or walking for a long time. Going up and down your stairs. And there might be some other problems. Be sure to talk to one of the kinesiologists within the family health team if there's some activities that you really wish to get back to, or just have some ideas on how to do them a little bit more safely and with less pain. We're here to help. Multiple modifiable risk factors can cause arthritis. There are many risk factors contributing to the development of osteoarthritis, and the risk for osteoarthritis increases with the number of risk factors you have. The risk factors can be divided into two sections: factors we cannot change and factors that we can, to help influence and limit the amount of osteoarthritis symptoms we have. First, joint injury. Joint injury prevention programs have been introduced, especially in sports where injuries in knees and hips are common. Even injuries earlier in life will increase your risk of developing osteoarthritis. Joint overload. Exposing your joint to too many loads for many hours over many years will increase the risk and rate of your development of osteoarthritis. Within some professions, with heavy work, age, sex, and genetics are non-modifiable risk factors. Age. As already mentioned, osteoarthritis becomes more frequent with increasing age, and this is primarily because osteoarthritic changes of cartilage and bone don't disappear. Those who get osteoarthritis will still have osteoarthritis when they get older. However, that doesn't mean that symptoms will continue to get worse. They can also get better and fluctuate up and down over time. Sex. So women are more likely to develop osteoarthritis. At an older age, women often develop osteoarthritis of the hands and knees, while hip osteoarthritis is more common amongst men. Genetics also play a part. If one or both parents have osteoarthritis, then the risk that their child will develop osteoarthritis as an adult is much higher. Recent studies, however, are showing that we can to some extent, modify this genetic risk by adopting a healthy lifestyle. Let's get moving. The key message here is that imaging is not a good method to diagnose osteoarthritis. The link between imaging changes on an X-ray and symptoms is generally poor. About half of the people who experience osteoarthritis pain have no visible changes on their imaging. It is also common to see changes on imaging that suggest osteoarthritis while the person has no symptoms. Only about half of the people with imaging changes have symptoms. Therefore, imaging is not a good method to diagnose osteoarthritis. Imaging should primarily be used for later stages of osteoarthritis when surgery is being considered. The patient's symptoms and not the imaging changes should guide your choice of treatment. We know that exercise and weight loss, if you are overweight, are effective in reducing pain and improving physical function. It is important to note that findings on imaging are normal. So the poor link between imaging and symptoms is not only related to the hip and knee joint. You don't have to read everything that is on this slide, but the picture here shows us that there has been much research done on different parts of the body, such as the neck, shoulder, lower back, and foot. That also shows that lots of people without any symptoms have findings on X-rays and MRIs. Think of imaging like a portrait of you from the inside. Just as we have differences on the outside, like wrinkles and facial features or scars, etc., we have differences on the inside. Age and lifestyle, genetics, and other factors will have impact without necessarily causing pain. Osteoarthritis really should be diagnosed without imaging. Imaging is still often used to make the diagnosis of osteoarthritis. However, the diagnosis can also be made based on your symptoms, existing risk factors, and findings from a clinical examination. Most clinical guidelines now tell us that imaging is no longer required for the diagnosis of your knee or hip osteoarthritis. These changes to the joint seen on imaging are reduced joint spaces, cartilage cannot be seen on X-ray, osteophytes, which are your bony enlargements or any bone spurs, cyst formations, and increased density of the bone beneath the cartilage. Symptoms of osteoarthritis can present 10 to 15 years before changes are seen on your imaging. By listening to the patient's medical history, the occurrence of pain, and other symptoms, consider risk factors and examining the joint, the diagnosis can be made early and the treatment can start earlier. There is no pill that can prevent or cure osteoarthritis. The treatment today aims at reducing symptoms and improving joint function by better understanding the disease, being better informed about the treatments available, by getting started with neuromuscular exercise, and finally by increasing your physical activity level and perhaps losing weight if it's needed. Contemporary osteoarthritis treatment can be illustrated as a pyramid. At the bottom and on the first level of treatment, you can find the cornerstone of treatments that should be offered to all patients seeking care for their joint pain: education about osteoarthritis, supervised exercise therapy, and weight control. This is the treatment level that you are currently receiving. In the middle of the pyramid, we have what some need, because for some, the first level of treatment does not provide enough symptom relief and can be complemented with pain relief medication and other passive treatments that can be provided by a therapist, like a TENS machine or manual therapy, braces, shoe insoles, walking aids, or in some instances, injections. And the last level of treatment at the top of the pyramid would be surgery. Most people with osteoarthritis can manage their symptoms without surgery, however. The main message here is first-line treatment first. International guidelines recommend that all people seeking care for osteoarthritis should be offered exercise, therapy, patient education, and weight reduction if overweight. Nevertheless, many people do not adequately trial first-line treatment in the first place. When first-line treatments are not providing enough symptom relief, we might consider adding a second-line treatment. Second-line treatments have varying levels of evidence to support their use, but they are associated with a benefit in reducing pain in the short term. Second-line treatments should not replace first-line treatments, but rather take the edge off of your pain to allow you the movement and the control necessary to begin your first-line treatments. And eventually, your first-line treatments will be able to manage your pain and symptoms so that second-line treatments are no longer needed. So here are some non-pharmacological second-line treatment options. And think of these as supporting you to be able to participate in first-line treatment options. The base of the pyramid is still the most important, and it's going to help you get to the root cause of your symptoms and to help ease them in the long run. So sometimes these second-line treatments are necessary to enable you to be able to have the decrease in your pain to be able to participate in the exercises as first-line therapy. Pain medications. So paracetamol, which is like aspirin or acetaminophen, really has little or no effect on muscle and joint pain and has no effect compared to placebo, some studies have found. Remember that a placebo is any treatment that has no active properties, such as a sugar pill. So paracetamol is probably the safest pain medication to take. There are few side effects compared to the other types of pain medication, but high doses can result in some liver damage, so we want to be mindful of that. Other types of pain medications people use would be our NSAIDs, which stands for non-steroidal anti-inflammatories. They're estimated to be more effective for pain relief than paracetamol, but again, the evidence is a little bit lacking, and they are also associated with side effects for the gastrointestinal system, so stomach ulcers, for example, kidneys as well, and they also have increased risk for cardiovascular disease. So we are encouraging people to avoid using NSAIDs if you have gastrointestinal disease or other chronic diseases like heart disease, or if you take medication for high blood pressure. You could consider topical applications instead, like NSAID creams or gels, which are also effective, but safer for the stomach in small doses. The side effects for NSAIDs are dose dependent, and research has shown increases in mortality after only 1 week of use. So if you take NSAIDs, it should always be with the consultation of a doctor and with the shortest amount of time and in the lowest possible dose, and after careful considerations of the side effects. And remember, pain medication is just to kind of take that edge off to get you back into doing the exercise, which will really help to get to the root cause of your discomfort. Opioids are another type of pain medicine, and it is important to note that they provide no better pain relief than those non-steroidal anti-inflammatory drugs that were listed on the previous screen, such as Tylenol or Advil. And so oftentimes associated with opioids are unwanted side effects and serious adverse events associated with long-term use. It is usually recommended against the use of opioids when managing your osteoarthritis. Exercise is a great way to help reduce the amount of pain you're experiencing. However, initially you might need some support, and we might consider using those over-the-counter or non-steroidal anti-inflammatory drugs to do so. Cortisone injections are usually not recommended for osteoarthritis. They have no long-term benefits, and short-term effects on pain vary quite a lot. It is important to know that the higher number of injections you have in the same tissue, the higher the risk for tissue breakdown. All in all, research shows that the placebo effect often is as big as the medical effect. This means that you will experience the same effect if you take a pain medicine or an ineffective calcium pill, or a saline injection. If you believe or expect the medicine will give you pain relief, then it actually will. All medication has side effects, and the higher dose you take, the more the side effects you will typically experience. Therefore, continue to discuss with your doctor or nurse practitioner, or even your pharmacist, and carefully consider your consumption of medicine. Glucosamine is naturally found in the joints. Initially, it was thought that taking glucosamine would help reduce joint pain and rebuild your cartilage. As we have the results of more studies comparing glucosamine and a placebo, it has now been shown that the effect on pain or change in cartilage structure is no different than the effects from a sugar pill. On the other hand, glucosamine has no dangerous side effects, unlike the medications we've just talked about. Psychological effects of managing pain may be triggered by taking a pill we believe is effective. If you are interested in trying glucosamine, it is advised that you try it for about 6 weeks, then stop the treatment. If you get worse after you have stopped taking glucosamine, and better when you start taking it again, one can assume that the treatment has some benefits for you. Other dietary supplements, currently there's really no good evidence, and there's quite a bit of uncertainty about the effects of different kinds of dietary supplements, such as rose hips, ginger, fish oil, or other herbal products. However, it is important to emphasize that there is not the same risk of adverse effects like pain medications that we just talked about. So surgery should really be reserved only for those people not responding to first and second line treatments. For many years, surgeons have used arthroscopic or keyhole surgery to clean up the joint and remove the loose parts from the meniscus or cartilage, particularly after a joint injury. This procedure has many names and types, including house cleaning, joint cleanup, debridement, partial meniscectomy, and scopes. It is a very common procedure, and it is associated with a reduction in pain, usually about 30%. However, arthroscopy is no more effective than a placebo or a fake surgery in multiple studies with people with knee pain. Fake surgery is also associated with around a 30% pain reduction, meaning benefits are likely due to factors not related from the procedure. This could be post-surgical rehabilitation, better management of loads, reduced fear of exercise, or any other number of risk factors. The age of patients in these studies is 35 years and older, so not just older people. Although side effects are very rare after scopes or keyhole surgery, but they do exist. The most common side effects are symptomatic deep venous thrombosis, pulmonary embolism, infection, and sometimes death. Therefore, many osteoarthritis treatment guidelines from around the world recommend against performing these procedures. Any surgical procedure has risks which must be considered. Joint replacement is a good operation for the right person. It should not be provided to people who have not adequately trialed first-line treatments, including education, supervised exercise therapy, and weight management when needed. Total joint replacement is a procedure in which the joint surfaces are removed and replaced by new joint surfaces made from plastic and metal. Although most people benefit from this big procedure, not all do. Most people are satisfied with the result, but at least 10 to 20% still have at least the same pain or other problems after surgery. This is a major surgery that cannot be undone, and as with all types of surgeries, it does have side effects. Therefore, it seems wise to have fully explored and tried all other treatment options first. People who complete a program like GLAD might delay or perhaps even prevent surgery altogether. If you have osteoarthritis in only one part of your knee, either the inner or the outer part, the surgeon may suggest that you have an osteotomy performed. This procedure is done if one or if one of the two joint surfaces, either the inner or the outer, is largely unaffected by your osteoarthritis. A wedge-shaped part of the bone is removed to redistribute the load to the joint's healthy inner or outer surface. As with all surgeries, there are risks and potential complications. Completing an exercise program like GLAD first means that you are better prepared for your surgery. You may experience faster recovery and will be well prepared for your rehabilitation, which often has the same exercise approach. Therefore, participating in an exercise program like GLAD can be very beneficial, even though you are already signed up for surgery. This slide shows the effect from different types of treatment, from education to weight loss to exercise or to using certain types of medication like acetaminophen, NSAIDs, gels, or even bracing. What we see here is that exercising twice weekly has a much greater pain relieving effect than the traditional pain medicines or even weight loss. The higher a box is, the greater the pain relief, which is the dark color, or improvement in physical function, which is the white color. Of note, traditional pain medication, such as acetaminophen, which is the same as paracetamol or aspirin. NSAIDs would include ibuprofen, Motrin, Advil, and naproxen. Here's the summary slide of some key points discussed today. Osteoarthritis is a painful disease that affects the entire joint and is influenced by many factors. Some of these factors are modifiable and others are not. There is often a poor link between imaging and symptoms, and usually we don't use x-rays to diagnose your osteoarthritis, but we rather go by physical exam and the symptoms you're experiencing. Education, supervised exercise therapy, and weight loss are the first line treatment to help you manage those symptoms and will continue to be first line throughout your journey with osteoarthritis. Exercises are at least as effective as medicine, if not more, and they also contain many positive side effects. This concludes our education session. We hope you found it helpful. If you have any questions or other concerns, please feel free to ask one of the kinesiologists within the Family Health Time next time that you see them, and we'd be happy to answer your questions. Thanks very much. Have a great day, and don't forget to exercise.